Hey guys, it's Dr. Carrie here from CJPT and Pilates, and the question of the day is, should you get an MRI if you've got neck or back pain or sciatica? And it's a controversial topic, if you will, and I get asked all the time, and most people want to get MRIs, they want to get scans because they believe that is the best way to figure out what is causing your pain. And the surprising answer is not maybe what you think it is. That's why I wrote an article about it, sort of the hidden dangers that you can get yourself into with MRIs, specifically for back pain. So if you want to read more about that, I talk about the research, I talk about what I've seen in the clinic. You can click below on that article and I go into more details. But here's the thing that I want you to know. MRIs are awesome. They're definitely needed when you've had trauma, emergency, or when you've got things that just don't look and smell right, they can't be figured out. You definitely need an MRI to see what's happening. But for musculoskeletal pain, it's a little bit different because 80% of the time, musculoskeletal problems, including neck and back pain and sciatica, are what we call mechanical in nature, which means it's kind of caused by life, things you do. It comes and goes. Certain activities will aggravate it. Certain activities will make it feel better. There's all sorts of things that can be responsible for mechanical pain, and 80% of the time your back pain or sciatica will fall into this category. So that means it's not related to a single structure, such as a bulging disc or a herniated disc or stenosis or arthritis or degenerative disc disease. Things like that can often be present and they can be a part of the problem, but they're not often the cause of the problem. So the mistake or the dangers of just getting pictures and relying on your MRI results to decide what to do are that everything is only looking at those structures and not looking at your whole body or your lifestyle or how you're doing things, how often you're doing things. Your behaviors definitely influence your pain. And if you falsely think it's only due to a structure and then you start going down the rabbit hole of procedures and surgeries, those things are really hard to come back from. You want those to be your absolute last resort after you've worked with someone who is a specialist in this kind of thing and can absolutely make sure that you're doing the right things to not only get rid of your pain, but keep it gone for the long term. So those are my thoughts on MRIs. It's like, I'm just not a fan. I've rarely had to refer people out for them, probably 5 or 6 patients in total in my 22 years, because they did have symptoms that I was concerned about. There's, and it's 5 to 10% of those cases are, really need surgery, and you need an MRI before you go and dive in and things like that. But for the most part, you really don't have to rush to get one. I'd hold off because it can confuse you more than it can help you. But read the article, let me know what you think. And, if you've got back or neck pain or sciatica that isn't going away and you're local to Portsmouth, hit us up. We'd love to talk with you. Maybe we can help.